Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Island families. We hope you enjoy this evening's edition.
Good evening and welcome to this edition of Labor Vision. We're back here tonight with our second segment on the Volunteer Income Tax Assistant or VITA program run by the United Way of Rhode Island. If you remember from the last segment, anyone making less than $55,000 a year is eligible to have their taxes done for free. And if you have children, you qualify for the EITC and child tax credit, which can put considerable cash refunds into the bank accounts of hardworking people like you. Last year, VITA volunteers completed 13,000 forms and saved taxpayers in Rhode Island $23 million. And the wonderful people who are our guests here tonight want to raise those numbers, and they've got some great ideas on how to do it. They are Zoya Tseytlin from Connect for Rhode Island Children and Families, and Roshni Darnal from Federal Hill House. So, Roshni and Zoya, welcome again to the show. Roshni, as coordinator of the Providence Coalition, I understand that you oversee 10 VITA sites in Providence, but you've got some ideas, and it's really exciting, about doing some new outreach into the community so we can get those numbers up higher. Can you tell us about that?
Yes, absolutely. So, you're correct. I do oversee the Providence EITC VITA Coalition, and we have 10 VITA sites all across the city of Providence. In addition to those VITA sites, we are also proposing to do pop-up VITA sites, as they're called, or we also refer to them as satellite sites. And the purpose of these sites are to take VITA to individuals, families, or taxpayers who may not have access to VITA in their local communities or in their neighborhoods. So we want to bring the program to them. And one way we're going to do that this year is by having pop-up sites at different union halls. Our first one is going to be on February 14th. The second one is scheduled for the 21st, and they're both going to be at ILSR.
Oh, the Institute for Labor Studies and Research.
Exactly.
In Cranston.
Absolutely. So anyone living in that community or neighborhood, including labor union members, are welcome to come and participate in the program. We're going to have volunteers who are ready to do returns. We bring all our infrastructure with us. So honestly, all people need to do is just show up with all their documents and just be prepared to have their taxes done.
Terrific. I know there's a number they can call to find out what they need to bring, but can you give us an idea of what the folks need to bring so that they can hear it from you?
Yeah, absolutely. So all taxpayers that walk into a VITA site need to present a original Social Security card, a copy of their ID, not a copy, actually an original ID, a Social Security and original ID. They also need to bring their W-2s if they worked last year or any other form of income that they might have had. So if they worked independently, a 1099 form, or if they had a small business, any relevant information pertaining to their income. They can also bring their child expenses information. If they had children in daycare, they can bring all of that information. If they purchased a home or anything pertaining to a major life event that could affect their tax returns. We also prepare returns for individuals that are 65 years and older, or that individuals that might be on disability that qualify for a specific Rhode Island credit called the Rhode Island Property Tax Relief Credit. So for individuals that are coming in for that, they need to bring in also their Social Security benefit award letter and their rent receipts.
Excellent. Now, Zoya, I understand that you've also got a report on some excellent new opportunities to have an even bigger outreach to folks to get those numbers even higher. Tell us about those opportunities.
Oh, yes. Yes, Jim. So we have been partnering over the years with several area colleges to promote the VITA program, recruit volunteers. But this year, Rhode Island College really stepped up and became a partner on a whole different level through their School of Management. United Way and Connecting for Children and Families outreach to Rhode Island College School of Management. We went out and did an orientation and information session for the volunteers, and we had a group of about close to 100 School of Management students come out, and they were interested in learning how to become a certified tax preparer through the IRS to participate in the VITA program. And many of those volunteers will be preparing returns all over the state of Rhode Island this tax season. Additionally, we will be holding tax preparation pop-up sites right on Rhode Island campus. Some of the dates that's going to be happening will be February 21st and 22nd. We'll have day and evening hours. And that tax preparation is going to be available for students, for staff, for faculty that qualify within the income guidelines, and also members of labor unions.
That's terrific. You got over 100 students in the management program willing to volunteer their time to do that. That's wonderful. Now, how do people find out, if they haven't written down tonight what we talked about, how can they find out where these pop-up sites are and where the colleges and the Rhode Island College program is when it's going to take place?
Absolutely. So
and maybe somewhere on the campus where it is as well.
Yeah. So for all the regular pop-up sites that Roshni had talked about, United Way 211 would be the best place to find out about those. And about the Rhode Island College sites as well, and specifically within Rhode Island College is going to be working with us, Connecting for Children and Families, and United Way to promote these tax preparation pop-up sites right on campus for those days and any additional days that there may need to come back and do more tax returns. So emails will be going out to all the students, staff, faculty, labor union members, with specific details, times, and location for those sites at Rhode Island College.
That's great. That's great. That's going to raise those numbers even higher. But I understand you also have a program planned for CCRI.
Yeah.
Just keeps going, doesn't it?
Yes. Yeah. This is this could be a really great year.
I think so.
We're very excited to be able to promote the VITA program. There's just so much opportunity for more Rhode Islanders to be able to save money on tax preparation fees, especially if they qualify under the 55 and under income guidelines. So we're going to be working, Connecting for Children and Families, United Way of Rhode Island, and CCRI on two of CCRI's campuses in Lincoln and in Warwick. We're going to be there every Wednesday for the month of February during the day, and we'll be working with veterans that are CCRI students, but also tax preparation services will be open to other students, faculty, staff, and labor union members as well.
Do individuals have to make an appointment for those events?
Yes, it will be by appointment, and Veteran Affairs Services right at CCRI campuses in Warwick and Lincoln would be the places to go to schedule an appointment. And there will be flyers going around to promote that program and to give out phone numbers or locations to go in and schedule appointments.
Okay, so you've got all these great folks that have volunteered to do these tax preparation for you for nothing. I have someone who's been doing my tax preparation for about 15 years now. I know him. He's a professional and someone I trust and does a terrific job. Tell us about the qualifications of the tax preparers that you have utilizing this service, this free service for the public. What can you tell us that'll help them feel confident about the fact that these folks are doing the right job and know what they're doing?
Certainly. Volunteers that would like to help out with the VITA program get training from the IRS. It's at least a 20-hour training program where they learn about income sources, credits that low to moderate income taxpayers qualify for, anything related to tax preparation to ensure that every taxpayer that comes to any of the VITA sites that are open within the state of Rhode Island and nationally, quite frankly, gets the same type of qualified service from the knowledgeable IRS certified tax preparers. So every preparer takes a certification test, goes through extensive training, and IRS checks to make sure that they're knowledgeable before they give out the certification. So taxpayers can have full comfort that there's going to be two sets of eyes, a preparer and a volunteer, reviewing and looking at every single tax return.
That's terrific.
And just to add to that,
sure.
A lot of our volunteers also return every year. So at many of the sites that you walk in, there is a very good possibility that a volunteer might have been doing this for, 2, 3, 5 years. A lot of volunteers have great passion for the program, and the certification process that Zoya was just mentioning is every year. So you have to get certified. Even like myself and Zoya, all of us, we all have to get certified every single year to be able to do the program. So
that's terrific. So somebody who has a favorite waiter they ask for, they can, after years of having their tax preparation day, I want to get Maria again to do my tax because she does a terrific job.
We absolutely have those requests.
That's fantastic. So I guess both of you, the first show we really explained the earned income tax credit benefits. Just quickly, can you give me an idea of what those credits are?
Absolutely.
What those benefits and credits are.
Yeah, so EITC, Earned Income Tax Credit, it's really a bipartisan credit. Everybody likes it because the credit is geared towards low to moderate income taxpayers, but it's also a credit for working families. So anyone, individual, family that has worked as a W-2 or self-employed qualifies for that credit. You could be single, you could be a single parent, a widower, a widow. You qualify for that credit as long as you have a W-2 and either self-employed or business.
That's terrific. Any other benefits that you can think of?
Well, there is the child tax credit. So the child tax credit are for families and individuals with children, and I think under the age of 17, parents qualify for up to $1,000 towards that credit. So between the EITC and the child tax credit for working families, it's a significant tax return that they can, put back right into the local economy and towards their own household, and it's a great benefit.
Yeah.
You did a remarkable job last year. You had 13,000 tax preparations done. You helped Rhode Islanders to put $23 million. That's a big number. Millions of dollars into their bank accounts and back into the community, as you say. That's remarkable good work, and I hope that everybody who's watching today understands that this is a terrific program. It's a federal program. The United Way goes out of their way to make it as special as it is. They take a lot of credit for this, connecting with children and families, and your organization, Federal Hill House. Thank you so much, first of all, for the fantastic work that you do. It's just incredible. And I know the numbers, when we do the show next year, I know the numbers are going to be a lot higher, and all due to you and all the great folks that volunteer to do the work with you. Well, that's our show tonight, and I will see you next time on Labor Vision.
Welcome to part 2 on our show, discussing the issues of Medicare. In part 1, we really took a look at what Medicare was. We took a look at parts A, B, possibly C, and D. Our guest this evening is back again. His name is Bob Dumais. He's a principal with Legacy Benefit Advisors. He works on a regular basis, as well as his partners, advising individuals prior to retirement and through the period of retirement on what are the best protocols, procedures, and the profile of that individual. What choices should they make? Welcome back, Bob.
Thank you.
We discussed probably more information that provoked more questions and answers in the last section. And I think that it would be good to pick it up around when you bring somebody in and you said, there are 3 pieces that we take a look at. We're taking a look at their budget, their lifestyle, their health. All of those factors will help you guide them to make the best decisions. So Bob Delaney comes to you. He says, I'm ready for retirement. What am I going to do?
We'll talk about your health first. Do you have medical conditions? Anything ongoing? What are you taking for prescriptions? Where do you get your care today? Is it in Rhode Island? Is it over the border? And then a very key question, sometimes difficult to ask, is, Bob, suppose you got a really bad diagnosis tomorrow, diagnosed with stage 4 cancer or something. Is the ability to leave Rhode Island for care, is that important to you? And a lot of people say, I never leave Rhode Island for anything, so I'm fine in Rhode Island. Other people say, I'd be in my car in a second. Some of the finest hospitals in the world are in Boston. So that would allow us to kind of narrow the field of options for you. And then we would talk about your lifestyle. Now that you're retiring, you're going to spend the entire year living in Rhode Island, or are you planning on spending extended stays somewhere nice and warm? And that again helps us narrow the choices. If you're going to spend half the year in Florida, it's important that we place you in coverage that's going to travel with you, because your exposure could be significant. And lastly is your budget. You have to buy Part B no matter what. But beyond Part B, there are Med Advantage plans that don't cost anything beyond Part B. On the other hand, if you stay with a traditional Medicare, you'll pay for a supplement and pay for a Part D. So, the cost can range from zero for, a Med Advantage plan to, several $100s or even more for a traditional original Medicare plan.
So we're really taking a look at, if you spend more money, do you get a better plan? It's a tough question, because there are people who are paying more money than somebody else for the exact same coverage. But when you say you may be able to buy or have the government to have your Medicare transferred to a private plan, is there a ratio between how much you pay and the kind of coverage that you get?
That's really an excellent question. Because when I look at healthcare, I'm looking at it in terms of what's covered, what's not covered, to what degree is it covered, but lastly, how can I access that care? Because there are plans that are very, very rich plans that are built around a network of providers in the greater Rhode Island area. There's other plans that may be as rich with an open network, which allow you to go pretty much anywhere you want. But it can go either way. You can get a rich plan with limited access. You can get a less rich plan with better access. So they're really individual decisions. I mean, we meet with lots of couples, and the husband may end up in one choice and the wife may end up in a very different choice. We met with some of my relatives recently. She had a number of health issues. With her, access was very, very important. She went on traditional Medicare. She's paying more. His health status is much better, and the ability to get care outside of his state was not important to him. So they chose very different plans. They're both happy. It's different than when you're working and you can access a family plan or a two-person plan. When you go on Medicare, you are individual. Everybody is an individual. There is no...
Even if your spouse carries the plan and you're on your spouse's plan, your plan is individualized to you.
Right. When you retire, you'll have two individual plans, not a family plan.
Let's take a look at many people in New England who will live, in this case in Rhode Island, and may go to Florida for 4 months, 3 months a year. What happens? Do they have to have a plan that allows them to do that? If they're on traditional Medicare, does that transfer to Rhode Island? On the various parts that they have, or the plans within the part, does that travel with them?
So if you have traditional, original Medicare, that's the most flexibility you can get. You can go to providers anywhere in the country that participate with Medicare. And essentially, that's probably 95% of the provider network. It's too big a piece of business for providers to not service that population. So you get the broadest access with original traditional Medicare. If you then fill the gaps with a very rich supplement, like a plan Plan F, for example, which is the richest supplement, and then you add a drug component to that, you probably have the best health care coverage you've ever had in your life. You may have some exposure with the drug piece, depending on the donut hole and how many scripts you're taking, but there's no way to avoid that. On the other hand, if you go Med Advantage and you're choosing a carrier, this differs quite a bit because Rhode Island Blue Cross, for example, their Med Advantage plans are essentially built around their Rhode Island network of providers. United Healthcare, working in that same space, the Med Advantage space, United is a national company. So while the United Med Advantage network is a bit smaller than their open network, it still might include, all the hospitals in the Partners network in Boston, for example. So now you're bringing in access to Mass General and Brigham and Dana-Farber and some incredible hospitals. The Med Advantage route with Blue Cross is a bit more limiting. The Med Advantage route with United Healthcare is a bit broader in terms of access. That's just the access piece. The Blue Cross benefit could be better with weaker access. So you're always weighing the two. It's kind of like when you buy your car insurance. You can pick a high deductible and a lower premium.
Correct, yeah.
Or a lower deductible and a higher premium. And this is where we get into exposure. Like how much exposure do you want to handle? If you pick a Med Advantage plan that's on the weak side, you've got a lot of exposure. I mean, you could get sick and spend thousands of dollars out of your own money. On the other hand, if you pick an original traditional plan with an F supplement to go along with it and a good drug rider, I mean, you could get almost any surgery and not pay anything. It can be that rich.
Yeah, it's interesting to take a look at it because I really think that it's so critical for people to take a long look at their individual needs. Like I think you said in this section, you could have a husband and a wife in the same family whose needs are very different. And I think that it's really important for people to understand that in some cases there are people who will take a traditional Medicare plan and then may request to go to a Med Advantage or request to go back. There are limitations on those kind of decisions.
Right. In Rhode Island, if you start out on the original traditional Medicare side and you choose to go to the Med Advantage side, you can do that readily, no questions asked, during that open enrollment period, October 15th through December 7th. In Rhode Island, if you choose to go back, so you've been on Med Advantage for a while and now you want to go back to a traditional Medicare plan, the carriers that are offering the supplements in that space are going to ask questions. And depending on your answers to those questions, you may or may not be able to make that move. And one of the questions they ask, do you have any surgeries coming up? Or have you been in the hospital in the last so many months? If you can't answer no to these questions, you may not be able to go back the other way. Now, what's interesting is that I live in Massachusetts. In Massachusetts, they can never ask questions. But the trade-off in Massachusetts is you pay more. So the supplement that in Rhode Island might cost $130 is $200 in Massachusetts. But somebody in Massachusetts could, in fact, pick an Advantage plan today and then a few months later decide that they've got surgery coming up, they want to switch to a traditional plan, and then they could switch back. I mean, it would be a little crazy, but you have that flexibility.
But again, you say those are financial decisions in some ways because in some states, they're not allowed to ask questions. You can move back and forth between or among the plans. But in this particular case in Rhode Island, there are limitations on the kind of answers or kind of questions that they can ask that you have to honestly answer. And if you have any kind of pending surgery or pending conditions, that can impact your ability to be able to move from one piece to the next or vice versa.
Absolutely. Absolutely.
So I think in taking a look at many of these issues, it's important that people understand that they need to begin this planning process early. When do people have to register for Medicare?
So when you turn 65, assuming you have your 40 quarters, you will automatically get Part A. You don't have to do anything to initiate that. It just happens. If you're still working to age, 68 or 70 or something, you don't need to do anything else. You can just use the coverage you're getting from your employer. If you're not getting coverage from an employer, maybe you're retired, but maybe your spouse is working, your spouse has a family plan that's covering you, that coverage is still credible coverage, and your spouse is employed at that time, so the coverage is fine. There's some funky laws regarding how coverage is defined as credible. So, for example, the coverage has to meet a certain criteria to be credible. It's got to be good coverage. It can't be just a real poor health care plan. So that makes it credible. The other piece that makes it credible is that coverage coming from an employer. And this gets a little gray in some labor situations where somebody who's been a long-time union member, they might have an arrangement where maybe they retire at 65, but the union covers them for another year or another couple of years. And that can be great coverage, and it's wonderful coverage. It may not be at any cost to the union member, but that coverage is not deemed credible.
Because it didn't come from the employer per se.
The employer or the fund. For our purposes in this arena, a fund is essentially looked at like an employer.
An employer, correct, yeah.
So the coverage may not be deemed credible. And if it's not credible, when that coverage ends and the person chooses to go on, regular Medicare, they will face penalties. At that point, the government's going to say, you should have fired up your Part B earlier and your Part D earlier because the coverage you had was not credible because it wasn't coming from your employer at the time. So there's some oddball rules and regs that we deal with. We tend to take a very conservative approach. I know if I suggest that you go original traditional Medicare, you have the most flexibility moving forward. If you go the Med Advantage route, I'm going to be very cautious, putting you in that direction. I'm going to make it really clear what your limitations are if you go that route. Not necessarily bad. You may be fine with them, but you will understand them clearly.
Well, Bob, thank you for taking the time to come on and talk to everybody out there. The Institute is committed to providing education and training to people at all ages. And our intent in this particular show was to shed some light on Medicare and provide the opportunity for individuals to hear from an expert. Bob has been working with the people at the Institute for several years now, and we felt it was important to share that information with you. Bob, on behalf of everybody at the Institute and everybody here, I want to say thank you for taking the time. If people have any particular questions, they can contact you, contact the Institute. And as we move forward, we'll provide even more information. We're looking to do another section on Social Security. So keep us in mind and stay tuned. Thank you for watching. Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.